This presentation aims to create awareness of the unique experiences of the homeless Indigenous population in Canada. This PowerPoint presentation will be posted on YouTube in order to make it more accessible to our target audience. We will also have posters around campus which will contain QR codes that link people to the YouTube video of our pre-recorded PowerPoint presentation. Due to the majority of classes being online, we are aware that accessibility issues may arise as most students will not be on campus. Thus, as a means of rectifying this issue, we will also be creating digital versions of our posters and sharing it via student email to guarantee better accessibility. We will also be posting these digitized versions of our posters on social media platforms in order to reach an even wider audience. From class discussions, we learned that research done on family homelessness is little compared to the studies done on individual homelessness. This is because the concept of family homelessness is broad and includes a lot more variables and factors compared to individual homelessness. Since homelessness affects all aspects of the life of an individual, our project will look at the consequences of homelessness among Indigenous people and their families. Our project consists of 3 major sections. In the first section, we will be defining what Indigenous homelessness means, as well as providing a historical background that informs on the effect colonialism had on Indigenous peoples. We will also discuss some of the factors that cause homelessness among Indigenous people and their families, such as the impact of the Indian Act and residential schools. In the second section, we will detail several experiences of Indigenous people and their families based on research. Finally, in the third section, we will be discussing the impacts of Indigenous homelessness and explain social policies that have been implemented to ameliorate the homelessness of Indigenous people. Our main target audience for this presentation will be university students. The logic behind our selection of this target audience is that many young people are either unaware of the complex reasons why many Indigenous people are homeless, or they have negative preconceived notions about homelessness among Indigenous people. Our project aims to help reduce the stigma and dispel many of the preconceived notions young people may have about this group experiencing homelessness. Our project also aims to educate by basing the information provided on reliable secondary research, in order to correct the false stereotypes that have been created with factual information. In terms of awareness raising, through our project, we aim to spark these typically unheld conversations by holding one of our own, backed up with secondary research data centered on these significant topics. We also hope for our project to be an inspiration to others to continue having these conversations, as that will help spread the word about the circumstances facing Indigenous people. As stated above, alongside the various means of reaching the target audience that we have listed, we included that we would be posting the digitized versions of our posters on social media platforms. And our reasoning behind this medium is to reach even more young people in other universities, as we do not want to limit ourselves solely to the students at the University of Calgary.
With the media representations, we are forced to have a negative idea and conception of homelessness. Homelessness is defined as the lack of adequate and stable housing. In Canada, the Indigenous community are mostly exposed to homelessness compared to non-Indigenous communities. The concept of homelessness is worse in northern and remote areas of Canada. For example, in cities like Yellowknife, the homeless population is mostly made up of Indigenous persons. An article by Bilenga and Awosega in 2013 proposed that 6.97% of Indigenous people in urban areas are homeless, compared to 0.78% of the national average. Homelessness can be visible or hidden. Visible homelessness consists of the kind of homelessness that we clearly see, people sleeping on the streets, parks, etc. But hidden homelessness consists of the groups that make temporary lodging arrangements with friends and family. An article by Statistics Canada in 2016 found out that the Indigenous population are twice as likely as non-Indigenous groups to face hidden homelessness. In society, we tend to turn to victim blaming when it comes to the homeless population. We forget that there are other pathways that lead to homelessness and housing insecurity. Indigenous homelessness in Canada is influenced by a number of interrelated causes, including the continuing effects of Canada's colonial past and welfare system. There are many structural barriers that make it impossible for the Indigenous group to leave homelessness, and also a lot of governmental documents turn to blame the Indigenous community for the poor housing conditions they have on their reserves. This reinforces stereotypes and misconceptions about the Indigenous community, and they also absolve the government from taking responsibility for the poor environment and housing situations in Indigenous communities and reserves.
The Indian Act of 1876 was a cradle-to-grave legislation instituted by the Canadian government to govern every aspect of the life of the Indian. The Indian Act only involves the First Nations people, excluding the Métis and Inuit people. The Indian Act gave the government power over First Nations identity, their cultural practices, their education and political structures. The 1951 amendment to the Indian Act gave the government jurisdiction over First Nations children. This amendment led to the 60s coup, in which Indigenous children were forcefully taken from their homes and placed in residential schools because the government did not see Indigenous mothers as fit to have children. Indigenous children were put up for adoption to white settlers after being taken away from their homes. Survivors of the residential school system report abuse and maltreatment. The effects of the residential school system set a cycle of trauma for Indigenous people in Canada that still lingers on even after the close of the last residential school in 1996. Intergenerational trauma happens when trauma is passed down from parents to child and generations after them. The biology and genetic endowment, which is a social determinant of health, largely affects the health outcomes of Indigenous people. Consequently, many Indigenous people turn to drugs to cope with their trauma. Indigenous people are also disproportionately affected by opioid addictions and opioid-related deaths. There were 18% fentanyl and opioid-related deaths in Alberta among First Nations people compared to non-First Nations people. In Alberta and British Columbia, First Nations people were 5 times more likely to die from opioid abuse than non-First Nations people. Again, these results show the enormous impact of drug misuse on the health of Indigenous people. Many survivors of residential schools are unable to have healthy lives because one can argue that they continue to struggle with anxiety, depression, and past trauma. Furthermore, there is a correlation between the high levels of homelessness in Indigenous people, which includes First Nation, Métis, and Inuit people, and conditions that affect their health. Shia et al. 2015 found that Indigenous people living in a larger city with higher incomes and levels of education and being married as well were a protective factor against precarious living conditions. However, addictions were a risk factor for precarious housing among many Indigenous people. Indigenous people are also more likely to use drugs and experience homelessness at a much younger age than non-Indigenous people. Factors causing Indigenous homelessness. Some of the factors causing Indigenous homelessness in Canada include child welfare involvement. Alberta et al. 2020 found that Indigenous people are 4 times more likely to be involved with child welfare compared to non-Indigenous people. This shows that their increased likelihood for encounters with child welfare services is also a risk factor for homelessness. Unemployment and poverty. 1 in 4 Indigenous people in Canada experience the highest level of poverty, and 25% of them are living in poverty, as well as 40% of Indigenous children in Canada live in poverty, according to the Canadian Poverty Institute. Among Indigenous people, 53% of First Nations people on reserve experience poverty compared to 41% of First Nations people living off reserve. These numbers show the high rate of poverty among Indigenous people, poverty that can cause an Indigenous person to be homeless. Experiences of violence, such as domestic violence, statistics show that Indigenous women are 8 times more likely to experience domestic violence by their intimate partners. In an attempt to escape from the abuse and violence, many Indigenous women flee to shelters or become homeless. Indigenous people on reserves. Many First Nations people experience poor housing conditions on their reserves. The housing problem that the Indigenous people of Canada are suffering is the physical embodiment of the federal government's assimilationist policies. Due to the colonial influence, the Indigenous population were forced out of their homes and relocated onto reserves. In Canada, the conditions present in many of the reserves are extremely poor. This has contributed to the poor health of First Nations people. The isolated nature of the reserves has influenced the increase in unemployment among Indigenous people. Although over the years, certain attempts have been made to improve the conditions of the reserves, it is obvious that such attempts made by the government are not good enough. High-risk drinking water systems are more predominant among Indigenous people living on reserves. This is because of the unavailability of clean water. Due to the remote location of reserves, there are not enough developed infrastructures such as health facilities and schools. A study carried out by Fahrenholz et al. In 2017 detected high levels of fecal bacteria in drinking water on reserves. Jurek et al. 2017 also discovered that 72% of methyl mercury, an environmental pollutant, was present in the traditional dietary intake of First Nations people on reserves. The poor conditions of the drinking water system affects the health of Indigenous people and are responsible for the spread of infection among First Nations people on reserves and illnesses that are waterborne. In addition to the poor physiological health of First Nations people on reserves, there is also inadequate housing for First Nation people living on reserves. The Indian and Northern Affairs of Canada estimated a shortage of 8,500 houses and about 89,000 houses in need of repairs on reserves in 2011. Also, First Nations people living on reserves are 3 times more likely to be hospitalized for respiratory diseases due to poor housing conditions. The poor conditions of housing on reserves include overcrowding, dilapidated houses in need of major repairs, and poor air quality. These conditions affect the health of Indigenous people. They are worsened by the fact that there are not even enough health facilities on reserve to properly treat individuals with chronic infections, such as asthma, due to their living conditions and the presence of mold. These unbearable living conditions are indicative of the hidden homelessness that Indigenous people face and their precarious housing conditions. An example that we learned in class was the people of the Ottawa-Aboriginal River. Their living conditions are like the aforementioned precarious housing conditions. It is obvious that their remote location in northern Ontario and the harsh living conditions indicates the presence of hidden homelessness among these people. Many Indigenous people also experience racism and discrimination on reserves. Indigenous people living on reserves do not have access to several services. As explained earlier, many of them live in poor housing conditions and lack basic needs such as clean water. They lack emergency services such as fire protection in their houses. In 2011, 67% of Indigenous people living on reserves died from fire-related incidents, even though they make up only 16.7% of the Canadian population, according to the Manitoba Office of Fire Commissioner. Under the Indian Act, it is the government's responsibility to provide these basic services and infrastructures. However, the government has not done so, and many Indigenous people living on reserves still reside in poor conditions. Indigenous people receive less than half of the per capita funding spent on non-Indigenous people, and most of the federal funds do not make it to reserves. Chambers 2018 explains that fire deaths are produced on reserves because of the lack of infrastructure, unsafe heating sources, overcrowding, dilapidated housing, and lack of fire suppression. It is obvious that Indigenous people indeed experience structural racism and discrimination that contributes to both their hidden and visible homelessness.
The Indigenous population of Canada is affected by racialized violence, with housing concerns contributing to their sense of insecurity and homelessness. The goal of a shelter is to provide guidance and practical aids to persons in need of housing, as well as to advocate for a greater housing investment and legislation policies to enhance the lives of the homeless population. The homeless population requires access to these shelters in order to meet their fundamental living needs. There are many institutional barriers that influences who gets access to these shelters, even though they are made to provide help to the homeless populations. Most Indigenous groups have zero or low trust in governmental facilities and institutions. This is because of the historical trauma they had faced due to colonial influences. In Canada, the Indigenous population is at a higher risk of victimization compared to their non-Indigenous counterparts. Indigenous women have a roughly six-fold higher homicide rate than non-Indigenous women, as well as a greater rate of domestic violence, which is primarily due to the spouse or intimate partner. For this project, we recognize that it is important to listen to Indigenous perspectives on their experiences in homelessness, because nobody knows about these challenges other than the Indigenous people. This is why we reference the video of the Ottawa Aboriginal Coalition titled A Home of My Own. This video exposes the experiences of Indigenous populations in Ottawa, and it talks about their experiences in shelters and on the streets. Most of the reasons behind why they became homeless were because of the past hurt and intergenerational trauma that they faced. The influences and results of colonization on the Indigenous community led to many being disconnected from their culture due to assimilation, and this did a lot of harm to the population. In this video, Martel Bob, an Indigenous man, stayed in reserves until he was 6 years old. After he left the reserve, he bounced around from one group home to another. Martel Bob reports he became homeless at the age of 18 after being thrown out of a group home. When homeless people are driven out of shelters or group homes, they are not educated about the life after they leave. They are not trained on how to look for apartments or file taxes, and are left to fend for themselves without knowing what to do. Martel Bob had a negative experience with shelters, claiming that he had to cope with bed bugs and scabies at the mission shelter where he stayed after leaving the group home. Martel ended up on the streets due to his bad experiences with shelters. According to most participants in the video, they reported avoiding shelters because they were dirty and have people with addiction problems staying in them. Nobody intends to stay in a polluted environment, and people seeking to recover from addiction problems avoid shelters since they know that returning will lead to a relapse. Participants in this video also talk about shelters having requirements that stops some group of people from accessing the shelter. For example, they talked about how people being ill and sick lead to them losing their spot in the shelter. The video labels this group of people as the forgotten people. They're a vulnerable group and need the most help. From the stories of the four participants in this video, we can conclude that not a lot of Indigenous individuals trust and believe in shelters. Some would rather be on the streets than stay in shelters because of the experiences they had with them.
The history and consequences of colonization continue to have an impact on the Indigenous community. In order to help reduce and eradicate Indigenous homelessness, the Canadian government must remove institutional barriers and restrictions that prevent Indigenous persons from accessing programs such as the Housing First program. Personally, I believe that the impacts of colonial war are still present in the poor housing policies that Indigenous people endure, but they've now become economical. Governmental programs like the Truth and Reconciliation Commission of Canada were created to help amend the past and build a relationship between Canada and the Indigenous community. Indigenous people comprise a disproportionate percentage of the homeless population in many cities in Canada. Their experiences can be traced to past and present policies of assimilation and colonialism. To end homelessness, it is necessary that the paths into and out of homelessness for Indigenous populations be understood. Indigenous homelessness is still a serious public health challenge in many Canadian cities, despite their existing policy goals to end homelessness. As we discussed in lectures, attaining accuracy on the number of homeless people through point-in-time counts are difficult due to the different methods used to arrive at the estimates. Another means to help reduce and eradicate Indigenous homelessness is each city striving to measure all subpopulations equitably. The 2008 biennial count of homeless persons in Calgary indicated that Indigenous people comprised 15% of the homeless population compared to comprising 2.5% of the Calgary population. And this points to the possibility of inequities among populations. However, it is also likely that the number of homeless Indigenous people is largely underestimated, as this population is also overrepresented among the hidden homeless. Although it is important that counts by subpopulations be accurate for policymaking, perhaps a more important point is the need to understand the particular needs of a significant subpopulation so that programs and services to end homelessness are successful. Another means would be the recognition of the variability in social and political contexts. Indigenous people and their historic and present relations with the non-Indigenous people also shape the features of the city. Therefore, what one sees in a city is reflective of the relationships developed over time, and as such, generalizations about the experiences of Indigenous people in urban areas are difficult to make and should be avoided. This makes it a challenge to advance a national agenda or policy. However, program success depends heavily on attention to context and therefore cannot be ignored. And finally, an increased participation of Indigenous people in dissemination and policy development. The number of organizations available to provide representatives to participate as community-based researchers and in knowledge dissemination and policy development is limited. There are a small number of organizations where Indigenous people make up the majority of the governance structures. According to a study, 64% of organizations with Indigenous specific programs were NGOs governed by Indigenous people. An increased participation of Indigenous people in areas of policy development would lead to a better understanding of the challenges they face, especially in terms of Indigenous homelessness, and would be a step forward in mitigating these challenges. Through this presentation, we have provided the definition of Indigenous homelessness as well as a brief historical background on the impact of colonialism on Indigenous people. We have touched on some of the factors contributing to the cause of Indigenous homelessness, along with the real-life experiences of some Indigenous people experiencing this. We have also provided examples of existing social policies and suggested a few social changes that could be made in order to alleviate the homelessness of Indigenous peoples in Canada. We definitely believe that change is possible, and it begins with each and every one of us, hence the dissemination of this project. We strongly believe that bringing awareness to this topic will be a means to effective change.